Hello, coders. Welcome to Introduction to PCS Coding and the AMCI PCS Coding Lecture, Part 1. I'm Mrs. J, the Curriculum Director here at AMCI. Let's get started. All right, we'll begin by reviewing the learning objective. We only have one, and that is to provide instruction on PCS coding. And today we'll discuss PCS root operations and also how to code medical surgical procedures. This part we'll discuss root operations and how to do medical surgical procedure coding. All right, so what are our tools? Tools that we'll need to use for this lecture are your ICD-10-PCS coding manual. We highly recommend the Optum 360 because of the indicators that you have in your book, and it's just an all-around good text for PCS coding. All right, coders, let's talk a little more about what PCS is. PCS is the acronym for Procedural Coding System, and it's an international system of medical classification, and it's used for procedural coding. The Center for Medicare and Medicaid Services, the agency responsible for maintaining the inpatient procedure code set in the United States, they contracted 3M. Who is 3M? That 3M, yes, that's the 3M that makes office supplies. Well, now they have a health information systems, HIM system, and they in 1995 was contracted by Center for Medicare and Medicaid Services to develop PCS. Yes, to design and develop this procedure classification system, and this system was designed to replace ICD-9 Volume 3. Yes, so if you didn't know, prior to ICD-10, ICD-9 is used to have both diagnosis codes and procedure codes. And when the volume 3, the manual that had the volume 3 had the procedure codes in it. Now, fast forward to today, 3M took that volume 3 out and made PCS its own manual and own system, and here it is. So the result is ICD-10 PCS was released in 1998, and it's been updated annually ever since that time. Now, some of you might say, well, wait a minute, didn't it come out in 2015? Yes, it did for coding. However, um, in institutions were using it prior to it coming out. Yeah, somebody had to test it. Yeah. So we'll talk a little bit more about that later on in our studies, but let's go ahead and let's simplify what PCS is. It's the acronym of Procedural Coding System. This code set is primarily used for coding procedures rendered in inpatient facilities, specifically hospitals and other inpatient facilities. PCS is maintained by CMS. So are you ready, coders? You ready to learn about coding PCS? If so, let's first look at the PCS code and let's learn some fundamentals about it. All right, so the PCS code is a multitaxial code. That means there are many lines or elements for it to grow. In other words, it's granular. Yeah, not only can it grow in depth, not length, but depth. It's granular, and we're going to talk a little bit more about what that is, but they are 7 characters. There are no decimals used in a PCS code, and each character can be either an alpha or numeric code. And if it's an alpha code, it's not case sensitive. It doesn't matter if it's upper or lower, it has the same meaning. Just remember the letters O, and I are not used because it's easily confused with 0 and 1, and we always use 0 and 1, as you'll see in a moment. Now, this is how the PCS code is structured, and again, I said it's highly granular because it's highly specific. This code, in fact, every character of a PCS code has meaning and purpose toward developing a highly specific code. Now, let's take a look at the section, this section part, and what it means. You know what? Before I tell you about this section, I just want to mention that you've got 7 character spaces. The first is your section. The second is the body system. Third is the root operation. Fourth, your body part. Fifth is your approach. Sixth, device. And seventh is qualifier. Now I can talk to you about the section and define it a little more for you. Now, the section in PCS coding, this character is the first character, as you can see up on the upper right. It represents the section that you're coding for. Yeah, the section in the book. Let's take a look. Your first section value is 0, and this is the medical surgical section. So if this first character here on the upper right-hand corner is a 0, that means you're coding from the medical surgical section. If it's a 1, you're coding obstetrics. 2, placement. 3, administration. 4th, measurement and monitoring. 5, extracorporeal assistance and performance. 6, extracorporeal therapies. 7, osteopathic. 8, other procedures. 9, chiropractic. Now we've got some other values, and these are our letters. And a B value will say this is imaging, C is nuclear medicine, D, radiation therapy, 7, physical rehabilitation and diagnostic audiology, G, mental health, H, substance abuse treatment, and X says that this is a new technology procedure. All right, so this is pretty much where you're coding for in your CPT manual, what you are doing. So I think we are going to study, let's go ahead and study that medical and surgical section. This is the first section. It makes sense. It is the largest section in your PCS manual, and our discussion today will involve primarily this medical and surgical section. So let's get started and let's look at the code for a medical surgical procedure. All right, so a medical surgical PCS code has 7 characters as well. Now, this PCS code can tell you a lot about the procedure. As we've discussed, the first thing, the section, this tells you about where in the book we're coding for. So we know we're coding medical surgical, and it should be 0. The second tells you about the body system, where on the body or which body system you are coding, right? Third is your root operation. Now, the root operation is the actual procedure, and we'll talk about that very shortly. Now, the fourth character is the body part. All right, this is the body part that the surgery was performed on. Your fifth is your approach, and this is how the doctor entered the surgical site. And sixth is your device code. This tells you if anything was left in or on the body after surgery. We'll talk more about that too. And finally, your qualifier. The qualifier refines everything. It gives you more information about that procedure. So as you can see, this PCS code is highly granular. All right, so again, we know that the section talks about what section in the book you're coding for. All right, so another thing that you can do, you can just go right to your table of contents and look here, right here, where it says introduction. Right here, you can see the medical surgical section where it begins, the information that describes the medical surgical section on page 5, obstetrics, placement, administration, and so forth, right in this section. But just remember, your section is the section on the body and that medical surgical procedures are carried out on. This section also means the section in the book. Section should correspond to the coding table, and we'll talk about that a little later. But just know that the section means the section in the book. Now let's get going and let's talk about the body system, our second character. Now the body system is the part of the body being operated on. Well, the system of the body being operated on, okay? So here are your systems. They, on the upper right, you can, if you just want to stay focused and just know that this is our second character space, and the value for the body systems are outlined as such. You have value 0. If it's a value 0, this is the central nervous system. Value 1, peripheral. 2, heart and great vessels. Value 3, your upper arteries. 4, lower arteries. 5, upper veins. 6, lower veins. 7, lymphatic and hemic systems. I is 8, ear, nose, and sinus. 9, respiratory system begins your letters, and that's B. C is your mouth and throat. D is gastrointestinal system. If your second character is an F, that's your hepatobiliary system and pancreas. If it's a G, you're coding for the endocrine system. H, skin and breast. J, subcutaneous tissue and fascia. K, muscles. L, tendons. M, bursae and ligaments. N, head and facial bones. P, upper bones. Q, lower bones. R, upper joints. S, lower joints. T, urinary system. U, female reproductive system. V, male reproductive system. W, anatomical regions, general. X, anatomical regions, upper extremities, and Y, anatomical regions, lower extremities. So your second character will describe one of these body systems, and this is the body system that is being operated. Now, this is what your book will look like. Yes. So you will see that, of course, your first character will be a 0 because we're still in the medical surgical section, but your second character will correspond with the numbers that I've just described. All right. So let's just take a look at all of our body systems, and your book is arranged this way in the medical surgical section. Look at that, all in order. And so if you want, you might want to put your numbers here. And these numbers will represent your second character. Let me show you how I did it. I will put my 0 here, so for your central nervous, and then your 1, 2, 3, and so forth. And then remember that your letters begin with respiratory. And it's really important that you pay attention to these these body systems because they're not typical. They're not what we're accustomed to. Back in the day, if we were coding for, let's say someone had a pancreatectomy, Okay, so they had the pancreas removed. We would go right to the gastrointestinal system and we would code from that section in our CPT manuals. But remember, coders, this is not CPT, this is PCS. There's a new way of thinking. And the way to think is that these systems are a little more extensive. So it's a little more broad. So just know that don't just code what you knew. Just make yourself familiar with the new. And in this case, we have a gastrointestinal system, but we also have a hepatobiliary system and pancreas. And this is where you would code your pancreatectomy. All right. So let's take a look at some of the other sections. You got muscles, tendons, and this is not exactly, I may have missed a few, but you get the point, coders, that I'm trying to make. I do want to point out your anatomical regions, though. Anatomical regions, that's the section, that's the body system that there is, or body area that there's no system for. For instance, you have surgery on your abdomen. What system does that fall under? It could be. It could be your gastrointestinal, but what if you had a laceration to the abdomen? Well, this is where you would code it from. You would code it from the anatomical regions. Let's say that you had an inguinal hernia. Where would you code that from? What part of the body is your inguinal area? You would code from this area too, this anatomical region, the inguinal region. And also you've got some anatomical regions that are upper extremities like your arm. Yeah, let's say you had a laceration to your arm, and let's say there was no muscle involvement. Let's say it was just no particular involvement. Let's just say it was just repaired. You would code it from here, or you might code it from the skin. So just make sure that you make yourself familiar with your anatomical regions, and you can look in there, and you know how you can do that while we're on this page. This is called your character meanings page. So you can kind of look and see what your third, fourth, fifth, sixth, and seventh character meanings are at a glance. You do not code from this page, but at least it's at a glance view of what you can be coding for. But let's continue. All right, so we've talked about that second character, that body system or body area. Let's talk about the third character, that's your root operation. Now, coders, if you don't know anything, if I didn't tell you anything, the root operation is 50% of learning how to PCS code. Once you understand the root, you are 50% there. If you're taking the CCS course, then we're going to spend more time discussing root operations because they are key to understanding PCS coding. But one thing of note, if you studied CPT procedures, we coded procedures using surgical suffixes. In PCS coding, we use root operations. And root operations represent the objective of the procedure. In each root procedure, and there are 31 in the medical surgical section, there are 31 root operations, and you will need to understand these procedures, not necessarily what they are, but the objective of these procedures. So very quickly, I just want to call them all out by name. 0, when you see a 0 in this third character space, this represents alteration. If you see a 1, this is coded for bypass procedures. 2, coded for change procedures. 3, coded for control. 4, creation. 5, destruction. 6, detachment. 7, dilation. 8, division. 9, drainage. And now we begin our letters. B will represent excision, C, extirpation, D, extraction, F, fragmentation, G, fusion, H, insertion, J, inspection, K, mapping, L, occlusion, M, reattachment, N, release, P, removal, Q, repair, R, replacement, S, reposition, T, resection, V, restriction, W, revision, U, supplement, X, transfer, and Y, transplantation. And at a glance, coder, you might say, oh, wow, a lot of these have the same meaning. You might look at excision, you might look at a resection. You might look at these and say, you know what, or removal and say, these all have the same meaning. But you know what, coders? In PCS coding, they do not. So that is the key to learning root operations, learning their meanings and their objectives. So just as a reminder, when we coded CPT, we coded for those surgical suffixes. When we code PCS, we're coding for the root operations. Remember CPT, we coded for the otomy, ectomy, ostomy, opexy, plasty, raphy, endesis. And in PCS, this is the nature of the game. And just so you remember, when coding root operations, you should always keep the objective of the procedure in mind. What is the objective? What is that doctor's intended goal? What is the doctor trying to do? All right, so we don't have a lot of time evaluating these root operations, but in your own time, I want you to go ahead and reinforce your understanding of surgical roots by using our Quizlet feature. So if you're an AMCI student, go to your LMS, go to your study tools section in week 1, go there, you'll see your Quizlet and practice. And when you practice, you're going to learn the definitions of these root operations. Next up, let's talk about body parts. Now, not a whole lot to say about body part because the body parts are self-explanatory. This is the body part being operated. Yeah, so it's a body part being operated. And as you can see in this visual, you've got muscles, you've got veins, nerves, spleen, etc. The next character, character 5, this is the approach. The approach, I would say next to that root, the approach is about 25% important or as important. All right, so if you master that approach, it helps a lot. This is your 5th character. And let's go on the upper right, just so you can stay focused. And that 5th character tells you how the physician or surgeon is approaching the surgical site. And I grabbed this image from my PCS manual, and it's defined as such. So the approaches are right here where it says approach. And the first approach will be your open. This is cutting through the skin or mucous membrane and any other body layers necessary to expose the site of the procedure. The next approach, I don't want to talk about this approach right now because it combines the others. So let's go down to percutaneous. We know what percutaneous is. This is entry to the surgical site by puncture or a minor incision. All right, so if they put a minor incision, if it's a minor incision, then it's not considered open, all right? So if it's for the purpose of putting in that instrumentation to carry out that procedure, then it's just percutaneous. Now, percutaneous endoscopic, that's you going through the skin with a scope, and it also includes a minor incision. External, that means it's outside the body or it's on the mucous membrane. All right. And next, via natural or artificial opening. That means they went in a natural orifice, your mouth, nose, vagina, rectum, urethra. And then down below, via natural or artificial opening, endoscopic. That means they put a scope through your natural orifice, nose, mouth, vagina, rectum, urethra. Okay? Now let's go up here. This via natural or artificial opening, the nose, mouth, vagina, urethra, rectum. But they use a scope, a percutaneous scope to assist them. So they went through that orifice, but whether it's, they go through the orifice, but they use a scope not for the surgery, but for the purpose of assisting surgery. All right, I know that might be a little bit much, but it really isn't. So let's move on. Let's not get distracted. These are your approach. There are 7 major approaches, and you can find explanations of your approach right here in your table of contents. Table of contents, and you've got your appendices down here, and there is your approach. And look, this is your Appendix A. I would go to Appendix A because this is where I got my, that's where I got my clipping from. And also too, there's more on it. And also you'll see all the other appendices below it. Now, since approach is so important, I'd like to give you some visuals of approaches. We're still on the 5th character space. All right, so we know what open is. It is standard. You know, the doctor has gone through the skin, cuts through that skin or mucous membrane or other layers to expose the surgical site. Your percutaneous approach, this is a good example. They've gone through, they pierced through the skin and inserted the tool for surgery. Percutaneous endoscopic, they've gone through the skin and they've inserted the scope. The surgery is carried out through the scope. Now, via natural or artificial opening, the vagina, as you can see there, the tools have been inserted through the vagina and the surgery is being carried out. Now you've got via natural or artificial opening endoscopic. They're going through that natural orifice, in this case, the urethra, with a scope. Your key term, scope. And you've got natural or artificial opening with percutaneous endoscopic assistance approach. That means they went through a natural orifice. In this case, this patient's having an EGD. They're going through that orifice and they are using the scope for assistance. And finally, external. External is for procedures performed directly on the skin or mucous membranes, and they're performed indirectly by the application of external force through the skin or mucous membrane. All right, coders, I think you all get the picture. Now let's move on to the 6th character, the device. Now, the 6th character is for, I'm going up your upper right-hand corner, let's stay focused. These are for things that remain in or on the body after a procedure. Some device examples, and I got this from my appendix. These examples could be autologous tissue substitutes, synthetic tissue, drainage devices. Remember, these are things that remain after the procedure, on or off on or in the body. You have non-autologous tissue, intraluminal device, drainage device, your interbody fusion device. Hey, if you've had a discectomy, let's say that you have grafting, that's a device. If you have instrumentation, that too is a device. All right. These are some examples. And then also too, when you're coding for these devices and you're coding for graphs, they could be classified one of 5 ways. They could be autologous, non-autologous, synthetic, intraluminal, extraluminal. Now, autologous is the donor and the recipient are the same. Non-autologous means that the donor and the recipient are not the same person. Synthetic, that's material and it's not biologically derived, so it's man-made. Intraluminal means within the lumen or a tubular organ. Extraluminal, these are outside the lumen or tubular organ. All right, coders, so this is your 6th character. I think I went a little too fast. Your device. And now we're ready for the 7th character. Not a whole lot to say about the 7th character, but this is the qualifier. And the qualifier refines the procedure and further specifies or clarifies that procedure, and they're self-explanatory. So you will see very shortly what a 7th character qualifier can do. And you know what, coders? I'm ready to move on. I'm ready to move on to show you how to do PCS coding. And we're going to code from the medical surgical section. All right. Now, I like to start with this. Let's just outline the steps to looking up a medical surgical section PCS code. There are 4 steps. Step 1, locate the main term, that's your root operation, in the alphabetic index. Number 2, find the corresponding table. Number 3, continue to build your ICD-10-PCS codes by selecting a value from each column of the table, your corresponding table, for the remaining 4 characters using the keywords in your documentation. And 4, review all guidelines. And coders, remember the root. To know the objective of a procedure is to know the root. The root, the root. I was not going to sing that song. Okay, coders, but just know, to know the objective of the procedure is to know the root of the procedure. So you got to know what that doctor's intention is. What is the doctor trying to do? So before we go into coding, just want to show you that these are the root operations. You should have them handy when you're learning PCS coding. And let's focus on the objective of the roots. We didn't discuss the objectives of the root in this presentation. However, you are instructed to do it on your own through your Quizlet feature. And we're going to learn some of the root operations and their meanings right now. And you should have already discussed them in class during week 1 class, and you should be viewing this lecture after the week 1 class. All right. So again, don't forget to focus on the objective of the procedure when you're coding for the root operations. And one more thing that I want to show you. In your Appendix B, this is gold because it gives you the definitions and the objectives of the procedure. It tells you this is what the doctor is trying to do. So for instance, if an alteration is being done or performed, we know that this means that that doctor was trying to modify the anatomical structure of a body part without affecting the function of the body part. We know that if a bypass took place, the doctor was trying to alter the route of the passage of the contents of a tubular body part. In most cases, when you have bypass, like arterial bypass procedures, there you go, gastric bypass, there you go. Now, not all, but unlike CPT, the term doesn't always describe what's being done. Just want to tell you that. But so that's why it's important for you to study the root operations and their definitions, and you can do that using your Quizlet feature. All right, coders. Are you ready for your first exercise? Here we go. Excision of right ovary with cyst. All right, coders, so I'm going to walk you through this. The first thing that you have to do, let's identify what our root operation is first, okay? So our so how we do this, we don't just code or look up the words, we have to process what is being done. So think about the objective. And the objective happens to be the word that's the procedure, excision. So the objective of the procedure is to remove a portion of a body part. And how do we know that? Because that's the term that the documentation is saying. But let's go ahead and let's look up excision. We're going to go to the index and we're going to look up excision. So just so you know, it's right here. Cutting out or off without replacement a portion of a body part. Now, if this is for a diagnostic procedure, or let's say a biopsy, then we would use diagnostic as our 7th character. So let's just really focus on the first part. This is cutting out or off without replacement a portion of a body part. And how do we know it's a portion? I'm going to show you with an exercise coming down. We know this is excision because the documentation says so. So we're going to look up excision. The next that we're going to look up will be your subterm, excision of what? Excision of your ovary. Okay? And we have in our documentation excision of right ovary. So let's go below ovary, and there you have it. Boom, right ovary, 0UB0. All right, so we've got our 0UB0 code. It's our default code. So let's go and let's look it up. Yeah. We're going to have to, our step 2 is to verify it with the corresponding table. So we have to look for the 0UB0 table, and we know that 0 is medical surgical section, U is female reproductive system. Hey, wait a minute. All right, so is this the table? Well, we're in the female reproductive system, but this is not the table. This is the character meanings table. This isn't the specific table that we need. We need to go find the 0UB table. So behind this page, in alphanumeric order, we will find 0UB. So our step 2 is to find that corresponding table. There it is, 0UB, and I love, see these, the blue verbiage. This is your objective, and I like to read it while I'm studying because it reminds you that you are cutting out or off without replacement a portion of a body part. All right, so we're on the correct road. 0UB, medical surgical. Yeah, this is medical surgical section. U is female reproductive system, and B is excision. All right, our 4th character was given to us. It's 0, and guess what? It does match the fourth character body part of right ovary. Now, coders, it's our job to figure out the approach, the device, and the qualifier. All right, coders, what is the approach? If you said excision, open, outstanding. The reason why it's coded to open, there is no documentation that specifies that it was percutaneous. All right, so your default will be open. Okay, coders, what is the device? If you said Z, because that's the only option, outstanding. And finally, coders, what is your qualifier? Is this a diagnostic procedure or no qualifier? Well, what is a diagnostic procedure? It's a procedure carried out for the purpose of diagnosing a condition. Does it look like we're diagnosing something? We're removing this ovary? Absolutely, it is not diagnostic. So our seventh character will be Z, and our code is 0UB00ZZ. All right, coders, I hope you enjoyed that because it wasn't so bad, was it? No, it wasn't. All right, so let's do another, okay? All right, so we've got laparoscopic excision of right ovarian cyst. All right, coders, so we did some of the work already. So the root operation is excision. So what we're going to do is we're going to look up excision in our alphabetic index. All right, excision of what? Excision of ovary. Which ovary? It's the right ovary. So we're going to be driven to the 0UB0 table, the same exact table that we went to previous. So 0UB, medical surgical female reproductive system excision. So it looks like we've got a slightly different code. We know that the fourth character body part is the right ovary. We know the approach is different. Yes. Why is the approach different? Because our documentation says laparoscopic excision. So that means that it's not open, it's not just percutaneous, because we have to code for that scope. And you know what? I like percutaneous endoscopic. I like that. And I'm going to show you why, because you have to perceive what the physician is doing. And sometimes when we're coding CPT, we don't really think about the process, and we're going to do it in just a moment. So this is percutaneous endoscopic. This is no device, that's our only option, and this is not diagnostic. It is definitive, it is therapeutic, you know. So our code will be 0UB40ZZ. Now, coders, some of you may have selected 8. You might have said, all right, this patient has an ovarian cyst and it was laparoscopic and there was a scope. But guess what, coders? What does laparoscopic mean? Laparoscopic is a scope through the abdomen. They did not go through that patient's vagina or vaginal area. That is a, I guess you just kind of assumed that. But look at the documentation very carefully, and you will get this. You really will. All right, it's time, coders. Let's move on. Total right oophorectomy. Now, coders, if you want to go ahead and if you want to like solve these and I'm going too fast, just go ahead and press pause and solve away. All right, our first step, First, we have to determine what the root is. We know an oophorectomy is taking place. So that is excision of the ovary or removal of an ovary, right? But look at this documentation. It says total right oophorectomy. Whenever you see that total means complete removal. And what does complete or total removal? If you studied your root operations, you would have studied that cutting out or off without replacement all, keyword, all of a body part, that is your root operation will be resection. Right, so when it's completely removed, it's a resection, and we're going to the resection section. What are we resecting? We're going to resect the ovary. Which one? The right one. And you know what it is? It's 0 UT 0. I like to say out. Yes, out. They're taking it completely out. And 0 UT 0. Let's go to the 0 UT table, and remember these are in alphanumeric order, and it's easy if you know the body system that you're going to. So we know oophorectomy is a female reproductive system. We know that, but you can still look it up. 0 UT 0. There you go. 0 UT medical surgical. U is for female reproductive system, and T is for resection. So you're in the right section. And while you're learning, don't stop reading these definitions until they make sense to you. Cutting out or off without replacement all of a body part, that's resection. All right, so our document or our code documented says that we have our fourth character is 0, and we know that the fourth character 0 is right ovary. Now we have to get to the approach. What is the approach, coders? Well, if you remember, if it doesn't document that it is endoscopic or not, guess what? It's open. And your device character 6, no device, that's your only option. And your qualifier, you only have one option, that is Z. So your code, 0UT, 00ZZ. Okay, coders, how are you doing? Are you ready for another one? Okay, let's do it. Liver transplant with donor matched liver. All right, so if you want to pause it and solve it, go right ahead. But for those of you that want to stay tuned, what is your root operation? Remember, we have those 31 root operations. So which one is a good match? Which one fits? The root operation that you should have chosen is transplantation. So let's go to the index. And if you see right here, if you just looked up transplant, it would tell you to see transplantation, which is below it, and transplantation of what? The liver. And look at this, it gives us 6 characters. 0FY00Z. So let's go to the 0FY corresponding table. I'm in the correct section. This is medical surgical. This is hepatobiliary system and pancreas. We know this is it. Hepato means liver. And then Y is your transplantation. And don't forget, we're not above reading the definition. This definition is also the objective of the procedure, and the objective of this liver transplant is to put in all or a portion of a living body part taken from another individual or animal to physically take the place and or function of all or a portion of a similar body part. Now, if you take a moment and process that, I think you will agree that this is the correct root operation transplantation. All right, so our code given, it lists all 6 codes, and all we have to do is figure out the 7th character. So the 4th character body part shall be liver. The 5th character will be open. We don't have another option. 6th will be no device left into the body. And 7th, we have to determine if this is allogeneic, syngeneic, or zooplastic. So just so you know, here are the definitions of allogeneic, syngeneic, and zooplastic. Allogeneic are stem cells that are collected from a matching donor. Guess what? We have a donor-matched liver, so this is going to be the one we use. But just so you know, syngeneic or allogeneic transplantations that come from an identical twin. Yeah, so you got to be a twin, and zooplastic is of living tissue to the human body from an animal or other species. So that graft came from an animal, and you know what? We're going to choose 7th character qualifier 0 and our code 0FY00Z0. All right, coders, I got another one for you. So are you ready? I hope so. Here we go. Foreign body removal in right nostril using forceps. Okay, coders, go ahead and pause if you'd like to, but if you want to continue, what is your root operation? Well, we've got a foreign body removal. Now, although we didn't discuss the definitions, the root operation for foreign body removal from the right nostril will be extirpation. I'm going to look up extirpation. Extirpation of what? Nasal mucosa and soft tissue. It tells us to go to the 09CK table. When we go to the 09C table, this is medical surgical section, ear, nose, and sinus, and C, extirpation. Now, if you don't know what extirpation is taking or cutting out solid matter from a body part. Now, let's say that doesn't mean anything. Let's say it doesn't speak to you. They give you an explanation too. It says the solid matter may be an abnormal byproduct of a biological function, so like a blood clot or a foreign body, let's say a marble. And it may be embedded in a body part or in the lumen of a tubular body part. I would say that, yeah, your nostril is a tubular body part. The solid matter may or may not have been previously broken into pieces. All right, so that's some good information to know. So this is the correct table. Let's go ahead and find our 4th character body part, and our default gave us K. And if you look under K, nasal mucosa and soft tissue, we're going to select the nostril because the nostril is in the documentation. What's our 5th character approach? Our 5th character approach is external. Our 6th is no device. Our 7th is no qualifier. Now, this is external because this would not be considered a natural or artificial opening. This is external because it's the nostril. Now, if it were in the nasal canal, that'd be different, but this is definitely external. All right, coders, I think you may have learned a few things like the definition of extirpation and external usage. All right, coders, we have a few more. Let's move on. Oh, I don't want to forget 09C KXZZ is our code. Now we can move on. Our next exercise, excision of malignant melanoma from the skin of right ear. What is your root operation, coder? If you said excision, outstanding. Now we're going to take that word, that root operation, and we're going to look it up in the index. Excision of what? Excision of skin? Yes. What type of skin? Skin of the ear. Which ear? Right ear. There you go. And it gives us 6 characters, 0HB 2XZ. So we need to go find the corresponding table for 0HB, those 3 characters. And it tells us this is medical surgical section, skin and breast, excision. Now, what is our 4th character? Well, our default code says it's 2, and let's go ahead and see, and that is right. It's the skin of the right ear. And then our 5th character is X. Our 6th character is Z. And our 7th character is Z. And our code, 0HB2XZZ. All right, let's continue. Our documentation says endoscopic drainage of the left ethmoid sinus. All right, coders, what is your root operation? If you said drainage, way to go, outstanding. So we're going to take that drainage, we're going to look it up in the index. Drainage, what are we draining? We're draining the sinus. Yes, which sinus? The ethmoid or ethmoid, right here, right underneath. Which one? Left. There you go. So it's telling us 099V is our default. So let's go find the 099 table, the corresponding table. And the 099 table says this is for medical surgical, ear, nose, sinus, and drainage. And let's look at the definition or the objective of drainage. It means taking or letting out fluids and or gases from a body part. Okay, that's exactly what happened. We're draining the sinus. So what is our 4th character? Well, according to the default, it's V. Let's go ahead and verify that, yes, it is V. Ethmoid sinus, left. See how specific these codes are, coders? Very specific. Okay, coders, I'm going to let you tell me what you think the approach character is. What is character 5? Is it open, percutaneous, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening endoscopic? All right, coders, what say you? If you said via natural or artificial opening endoscopic, that is correct. Because, coders, if you look at your documentation, there is no mention of a specific type of scope. It's just saying endoscope. Endoscope is a general scope. So it is a logical assumption that that scope was placed in the nose. Yes, in the nose. Okay, and our 6th character, drainage device. Okay, that's the only thing that we have there. So I guess the drainage device was left in the body. And our 7th character is no qualifier. All right, so something doesn't look quite right with this code, and something I'm going to show you specifically what's wrong. All right, so our documentation says that this is an endoscopic drainage of the left ethmoid sinus, and we coded 099V80Z. So we said that a drainage device was left in place inside the body after the surgery. And you know what, coders? I didn't see that in the documentation. So I took another look and I realized that there's another part of this table down below it. You see the same characters. Look at this. And our code will be 099V8ZZ. Our fourth character will be ethmoid sinus left. Our fifth approach will be via natural artificial opening endoscopic, so still will stay 8. And then Z, no device. I like this because there was no mention of a device left in the body, and the final character will be Z. So that is my choice for the correct code. Now, I know some of you, as smart and sharp as you are, you saw that too. And another thing that I want to point out, you have to stay in the lane. When you're coding and you're selecting these characters for the body part, you have to stay in the lane. So you can't select elements or values from up down here, up there, down. You cannot do that. You have to stay in the lane. Stay on your row. Okay? All right. We have another exercise. Reattachment of severe left hand. All right, coders, what is the root operation? If you said reattachment, outstanding. Sorry about my on-clicks. Reattachment is your root operation, so we're going to look in the index. Reattachment, hand, left, and it gives us the code 0XMK0ZZ. Coders, that is the entire code. That's 7 characters long. So let's go ahead and verify our code by the tables. You've got 0XM, medical surgical section, anatomical regions, upper extremities. See how you use the anatomical regions, coder? All right. M for reattachment. So let's go ahead and read this objective. The definition of reattachment is putting back in or on all or a portion of a separated body part to its normal location or other suitable location. That sounds about right to me. Let's go ahead and see if the fourth character is correct. Our code says it's K. K is correct. This is your left hand, open approach, no device, no qualifier, coders. Our code 0XMK0ZZ. All right, we have a few more. Not really that many more. Below the knee amputation, distal portion, right leg. All right, coders, what is the root operation? If you said this patient had amputation, then it's a detachment. All amputations of extremities are detachments, and remember that the objective of a detachment or definition of detachment is cutting off all or part of the upper or lower extremity. The body part value is the site of the detachment with the qualifier, if applicable, to further specify the level where the extremity was detached. All right, so we're going to do something a little different because there's that 7th character qualifier needs to be further specified, and I'm going to show you something. All right, so detachment of what? Detachment of leg. Which leg? Right leg, and it gave us code 0Y6H0Z. All right, coders, so instead of going to the table, I'm going to instruct you from the character meanings page. Yes, I did say do not code from this, and we're really not. I just want to show you something. Right here, at a glance, you see all of the operations that can be carried out for this section, the body parts, the approach. These are pretty much the only ones, so I love this page as a general reference tool. Your devices that remain in or on the body for these procedures, and the qualifiers. Specifically, you've got zero, high, excuse me, zero is complete, high, mid, low, complete first ray, second, third. What is that? We don't really know what this is. However, if you turn the page, they explain what they are. So the detachment qualifier, this is a 7th character descriptions for a high amputation. This is amputation at the proximal portion of the shaft of the tibia or fibula. A mid is amputation at the middle portion of the shaft of the tibia fibula, and low is amputation at the distal portion of the shaft of the tibia or fibula. And ours happens to be low because we had a below knee amputation at the distal portion of the right leg. Distal is our key word. So I would suggest, and we use 7th character 3 if we're going to use this language in this definition. So I would suggest that you go back to your character meanings pages and write down what they mean. All right, so we know we have our code. Our code is 0Y6H0Z3, but let's go ahead and write down what high means. High means proximal, mid means mid, and low means distal. And if it's low, it's 3, and that is our code, 0Y6H0Z3. All right, coders, I've got one more for you. Are you ready? Here you go. Rectal polyp fulguration via sigmoidoscope. Rectal polyp fulguration via sigmoidoscope. All right, coders, what is your root operation? If you said, well, a fulguration was carried out, so what is that? That's destruction. Yes, fulguration is destruction. We're going to look up our root operation, destruction. Destruction of what? Rectum. Yeah, destruction, not necessarily of the rectum, but in the rectum. Okay, 0D5P. And we're going to go to the corresponding table, 0D5. Medical and surgical gastrointestinal system destruction. Destruction means the physical eradication of all or a portion of a body part by the direct use of energy, force, or destructive agent. All right, so an explanation is none of the body part is physically taken out. So they don't take out the body part. They're going to go ahead and destroy what is on that body part. And you know what? I believe this is correct. So let's go ahead and continue building our code. Our 4th character, the our code, our default says it's P. I agree, it is P. The 5th character, what do you think it is? Is it open, percutaneous, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening endoscopic? If you said via natural or artificial opening endoscopic, outstanding. Yes, the sigmoidoscope. We can take our knowledge from CPT coding. When we learn to code scopes, we learned the sigmoidoscope is inserted rectally. Yes. So if it's inserted rectally, that scope has a purpose. We know what that purpose is. So that is our approach. And our device shall be Z because that's the only option we have. And so is our 7th character qualifier. So coders, the final answer, 0D5P8ZZ. All right, coders, how do you feel? You all have done an amazing job. I just know it. Continue practicing. If you're an AMCI CCS student, you've got some homework, go ahead and do it. But you know what? I like to get started coding. I kind of do things differently, sometimes backwards. And we probably should have learned the roots in this presentation first, but you already have if you've gone to class. But let's go ahead and let's end things up by learning the roots and observing their similarities. All right? Okay. So we've got groups of root operations. And there's a group called the takeout group. There are 5 members of this takeout group. It's called takeout group because these 5 procedures, they take out some or all of a portion of a body part. Ladies and gentlemen, meet excision, resection, extraction, destruction, detachment. These are all members of the takeout group. And if you want to go ahead and take another look, you see your excision. Excision, that's your B character, your B value. Cutting out or cutting out or some of a body part without replacing it, like a breast lumpectomy. So you're cutting out some of the body part, or you're cutting out a part of the body part, but you're not cutting out all of it. So you are excision. An example right here, cutting excision of the fallopian tube and ovary. All right, resection. This is T. This is the one that I always remember. This is the first root operation that I remembered, T, because it is taking everything out. T for out, cutting out or off some of a body part without replacing that body part. So you're cutting that whole body part off, cutting it all the way off, all right, without replacing it. Look at that kidney. They're not taking off the tumor. They're not taking out a part. They're cutting off the whole kidney. All right? D, extraction. This is pulling out or off all or a portion of the body part without replacing that body part. Extraction, D and C, curettage, that is use of force of, the uterine lining, pulling. All right. Destruction, that's 5. That value is 5. This is eradicating all or a portion of the body part without taking out the place of a body part. An example is rectal polyp fulguration. Okay. And 6, detachment. That's your element, your value. And this is still cutting out and you're cutting off this extremity only. Remember, it's extremity without replacing that extremity. Example, below knee amputation. All right, let's say goodbye to the takeout group and let's meet the moving group. And there are 4 procedures in the moving group. These are procedures that put in, put back, or move some or all of a body part. This is your movers: transplantation, reattachment, reposition, and transfer. All right, so let's look at transplantation. The value is Y, putting in all or a portion of a living body part from another individual or animal physically takes the place and or function of all or a portion of a body part. An example is a heart transplant and also a kidney transplant. They put in this kidney and look down here, you see this extra kidney? They left the diseased kidneys intact and put the good one and put the graft down below. Next, reattachment. This is putting back in or all or small portion of a separated body part, putting in its normal or suitable location. Example is finger reattachment, as you see in this picture. And that is value M. Next value, S, reposition. This is moving all or a portion of a body part, moving to its normal or suitable location. Reposition, examples, reposition of undescended testes. So they're going to take these testes and they're going to push it back into place. That's typically called an orchiopexy or fixation. And the next value will be X. X is transfer. This is moving all or a portion of a body part without taking out the body part. A good example is a flap, a skin flap. And you can see this in the picture. If you can see it, it's very small. The patient had a mastectomy and they're taking the fat from the abdomen, the fat, the muscle, and they are putting it in the location where the breast used to be, and they're creating a breast, creating a graft. All right, coders, say so long to the movers and meet the unwanted stuff group. This unwanted group has 3 procedures. These are procedures that take out, eliminate, and or break down solid matter, foods, or gases from the body. These are unwanted: drainage, extirpation, and fragmentation. All right, so drainage is value 9, and this is taking or letting out fluids and or gases from a body part without taking any of the body part. So they're draining. An example is incision and drainage, taking out that fluid from that body part. Next, extirpation, taking or cutting out solid matter in a body part without taking any of the body part. The solid matter may be an abnormal byproduct of biological function. An example would be a thrombectomy to remove that thrombus. Next, fragmentation, value F, breaking into pieces solid matter within a body part. The physical force applied directly or indirectly is used to break that solid matter into pieces. An example would be a lithotripsy. Okay, coders, so say goodbye to those unwanted and say hello to the exam group. There are 2 procedures, and this represents procedures that involve only examination of body parts and regions. Example, inspection or mapping. The value J is for inspection, and this is visual and or manual exploration, some or all of a body part, visual exploration performed with or without optical instrumentation. Example, diagnostic arthroscopy, diagnostic cystoscopy. And finally, value K. K is used for mapping, and this is local route of passage of electrical impulses or functional areas in a body part, applicable only to cardiac conduction mechanism and central nervous system. So we're only dealing with the heart and the brain and the spinal cord, and an example would be cardiac mapping. All right, goodbye, inspection group or examination group. And let's say hello to the tube group. The tube group are procedures that alter the diameter or route of a tubular body part. So that's why it's called the tube group. You'll find your bypass, your dilations, occlusions, and restrictions, all members of the tube group. So bypass uses the value 1. When you see that 1, you know it's a bypass. If it's altering the route of passage, contents of a tubular body part, and it may include the use of living tissue, non-living biological material, or synthetic material. Example, gastrojejunal bypass, coronary artery bypass. Value 7, dilation. This is expanding an orifice or lumen of a tubular body part. An orifice may be natural or artificially created. An example of dilation would be percutaneous transluminal angioplasty, or PCTA. Value L, occlusion. This is completely closing an orifice or lumen or tubular body part. The orifice may be natural or artificially created, such as a natural orifice, such as fallopian tube, a tubal ligation. That's occlusion. That's an example. There's some good images to the right. Value V, restriction. This is partially closing an orifice or lumen of a tubular body part. The orifice may be natural or artificially created. Example, cervical clerclage. Oh, cervical cerclage. Sorry about that. Gastroesophageal fundoplication. Okay, it's getting late. Somebody save me. All right, next up, we've got the device group. There are 6 procedures in this device group, and the device group always involves a device. Insertion, replacement, supplement, removal, change, revision procedures all represent the device group. And if you have an insertion procedure, it'll be met with a value H. This is putting in or on biological device in or on a body part. Putting in a non-biological device that monitors, assists, performs, or prevents a physical function, but not take the place of that body part, then it is insertion. Example, pacemaker insertion or central line insertion. Value R. R is for replacement. This is putting in or on a biological material, synthetic material, or living tissue taken from the same individual. All or a portion of a body part physically takes the place or function of all or a portion of a body part. And an example would be the material used for a total hip replacement. Now, the next is supplement. Some people confuse the R with the U, the replacement with the supplement, but the difference is that the replacement is that replacement takes the place of the function of all or portion of the body part, whereas the supplement, U, value U, is not. So putting in or on a device that reinforces or augments a body part or replaced body part, biological material is non-living or it's living and from the same individual. Value P, this is removal. This is taking a device out or off a body part. If a new device is inserted via incision or puncture procedure, that's coded separate. So an example would be a cardiac pacemaker removal or a central line removal. All right. Value 2, change. This is taking a device out or off without putting back an identical or similar device in or on a body part without cutting or puncturing. An example would be changing your drainage tube bag. All right. So you're not puncturing the person, you're just changing that bag on the outside of the body. And finally, revision, that's value W. This is correcting to the extent possible a malfunctioning or replaced device in or on a body part, correcting the position or function of a previous placed device. Example, a hip prosthesis adjustment, revision of a pacemaker lead. So they're correcting it. That's your key word. All right, coders, say goodbye to the device group and let's say hello to the cutting group. All right, so there are only 2 procedures in the cutting group. Who'd have thought? All right, so the cutting group are procedures that involve cutting or separating only. All right, so division and release are members of the cutting group. All right, so division, that character will be 8, and this is cutting into, separating a body part without taking out any of the body part or draining fluids and or gases. So they're just pretty much cutting into. So an osteotomy, a neurology. Neurology, okay, I think that's a mistake. Episiotomy. Okay. What about neurotomy? Okay. All right. So next, release. This is N. The value is N, and it's freeing by cutting or by the use of force of a body part, freeing a body part from abnormal constraint without taking any of the body part. So good example would be peritoneal adhesions or adhesiolysis. Adhesiolysis, this is removal of the lysis of adhesions of the peritoneal. All right, we've got 2 in the fix-it group. Yes, these are procedures that define other repairs, the control or the repair group. So we're going to call it the fix-it. Control and repair are the members of the fix-it group. And you've got your value 3, control. This is stopping or attempting to stop post-procedural bleeding limited to an anatomical region, not specific body parts. So an example would be control of bleeding post-prostatectomy, post-hysterectomy. Another, repair value Q. This is restoring to the extent possible normal anatomic structure and function of a body part, used only when the method is to accomplish the repair and it's not any of the other root operations, such as a hernia repair, such as a suture laceration. Okay. All right, let's say so long to the fix-it group. Now let's discuss the leftovers. These are procedures that don't fit anywhere else. They're the leftovers group. And these are procedures that define other objectives. You have your alteration, your creation, and fusion. All right, value 0. This is modifying the natural anatomical structure a body of a body part without affecting function of the body part, performed for cosmetic purposes. So that says it in itself. Alterations are cosmetic procedures. An example is facelift. Creation, value 4. This is making new an anatomical structure. Genital structure does not physically take the place of a body part, used only for sex operations. So creating an artificial vagina, creating an artificial penis is creation. So they're only used for sex change operations. And finally, G, fusion. This is unification and keyword and immobilization of a joint or articular body part, stabilization by fixation device, graft, and other means. An example of fusion is spinal fusion. All right, coders. So where did I get all that from? I got them all from Appendix B. They have the definitions of these procedures, these root operations, and in this section, they also place them in categories, just like I've done. So I encourage you to go to your Appendix B, learn those root operations, and if it speaks to you, use Quizlet because Quizlet is fun. You can play, you can learn your surgical root operations. So definitely go to your LMS, go to your study tools, click on Quizlet, and go ahead and learn those root operations. All right, coders. Thank you for your attention. I know you gave me your undivided, and hopefully you're one step closer to PCS coding, and we will return with part 2.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.